clinic patient psychology thing on battling the preconceptions of the patient when you're working. My most of my work is in accidents, and when you're working with the population, a lot of them are going to have preconceptions about how they're going to feel in the long term, especially as you start to get imaging and things like that back. And you always have to be prepared to keep things in context with the person and help them navigate the situation as best possible, because you're going to be battling everything that they're hearing from the outside away from your clinic at all times. So if they have so if the patient's never been in an accident, never had an MRI before, never really had x-rays before, you're going to have to be the person that's going to have to help them through that process of going through the imaging and understanding what it all means, and understand what it means for long-term outcomes, because they're going to hear from friends and family members, and strangers, whoever else outside of your office after you read them the report. They'll go talk to Uncle Jim, and he'll say, well, what they say at the doctor's office, and they'll tell him about how they were in this accident and they have this disc bulge and all this stuff, and then they're going to get this long negative story about Uncle Jim's disc bulge or Uncle Jim's friend at work's disc bulge, and how now he's in a wheelchair, or he had to go on disability, or had to have 6 back surgeries, or whatever it is. And the same thing can be said just for the accident in general, which happens quite a bit as well. Even if we have all the imaging after the accident and all the X-ray, MRI, CT scans, whatever's done, all comes back normal with nothing, nothing remarkable to discuss. A lot of patients still, they'll have heard from someone, their neighbor, that, well, they were in a car accident and they were just never the same. Or, we've even had people recently in the last year or so, tell me, hello, tell me, well, I'm going to be in pain the rest of my life because I was in a car accident. And those things just are unequivocally not true. We routinely discharge people from care, anywhere from 1 to 3 months after their accident, pain-free, and they're back to all their normal activities, even if they do have some sort of injury to a disc, or pretty big sprain strain incident. It's still more common than not common that person is back to their normal activities and routine within 60 to 90 days. So having those conversations with a person is very crucial and critical up front, because you have to position yourself, and you have to have them think of you as the authority on the situation, and not be taking the advice and the stories from the people down the street from them. Even though sometimes those can hit harder, you just have to make sure that you're prepared as a clinician, to listen to those stories that they tell you, but then to still reassure them that you guys are on the right path, we're doing the right things, and the majority of these cases are going to resolve without much incident. And all you can do is hope that you can get through to the person, and that they decide that they should value your clinical expertise and opinion, and years of working with people over whoever they are talking to at home about what they should expect given what you've told them at the office. So just always keep that in mind. Patients are going to hear a lot of stuff from all sorts of sources. You have to help them filter out that noise, keep them on track, and make sure that they still get the best possible outcome. So hope that helpful for everyone. Check out my YouTube for a bunch of other discussions I have on patient care, and see you next time.